Assalamu alaikum, the communication day. First scenario, you are the medical registrar on the hospital ward today. You have been asked to speak to Mr. John Anderson's daughter, Mrs. Emily Anderson, regarding her father's condition. Mr. Anderson has long-standing COPD and dementia. He was admitted with worsening chest, short of breath, and confusion. He was on a course of antibiotics, IV antibiotics for the chest infection, and has now developed clostridium difficile infection, causing diarrhea and dehydration. His daughter is concerned about his worsening condition and wants to understand the severity of the situation. Your task is to explain the new diagnosis, discuss management plan, and address the family's concerns. Okay, ready, Dr. Ala?
Yes, Dr. Basim, ready.
Okay, here you
Hello, I'm Dr. Mitwali. I'm the doctor in the medical ward today. Let me confirm you are Mrs. Emily, daughter of Mr. John Anderson.
Yes, I am Emily.
Okay, Mrs. Emily, you are the next of kin to Mr. John.
Yes, doctor, I am his daughter.
Okay, we are here today to discuss about his health condition. Is that okay with you?
Yes, doctor.
Before I proceed further, can you tell me how much you know about his condition?
Yes, doctor. My father, he has lung problem in the lung, and he started recently to forget something. The doctor told me he has dementia, but I don't know. Since a few days, his breathing not well, and I feel he breathe difficulty. For that, I brought him to the hospital, and the doctor he told me, well, he will keep him in the hospital, and he will start for him some medication. But now, doctor, I talked with the nurse. She told me he has another infection. I don't know what's happening, doctor.
Yeah, I'm sorry for what you have been going through, Mrs. Emily. Uh, as you have mentioned already that he had been admitted here to the hospital with this bug infection in his lung. Okay, and we give him treatment of this bug infection in the best interest of his condition in the form of antibiotics, which are being given through his blood channel. Okay.
Yes.
Yeah. So the one of the bad effects of this antibiotic that it can cause some sort of disturbance in the bacteria that we have already in the gut. Okay. We have in the gut multiple types of bacteria. There are harmful types and there are beneficial types. Sometimes antibiotics, when we are giving the antibiotics, one of the bad effects of the antibiotic that it can cause disturbance of these bacteria and it can cause overgrowth of the harmful types of the bacteria in the gut. Are you getting me?
Yes, doctor. Are you sure, doctor, this is from the medication? Because I saw the nurse handling my father without gloves. Maybe she bring the infection from another patient for my father, doctor.
Yeah, I understand your worries, Mrs. Emily, and I'm sorry for what you have seen from the nurse. Okay, I will discuss this with the charge nurse and we will try to figure out what happened and to see exactly what happened. But as I have mentioned to you, the main cause of such bacteria, which you are calling clostridium difficile, I'm sorry for this term, but this is the name of the bacteria. This bacteria is coming because, as I mentioned to you, disturbance and or problem because of the medication that you are giving, and it caused him to have loose motions and also decrease in the fluids in his body, and also some deterioration in his condition. Okay, are you following me?
Yes, doctor. Yes, doctor. It is serious infection, doctor.
Actually, Mrs. Emily, it can be serious if not treated properly. And I'm sorry to tell you that in some cases, this condition can be serious and it can result in more advanced problem that it can affect the functions of the kidney. It can also result in serious problems in the gut and the bowels also. But be sure that we will give him the proper management plan. We have already stopped this antibiotic and we started already in another type of antibiotic with less harm on the gut to treat his bug infection in the lung. And also we started him in the proper treatment for this bug infection in his gut. Are you following me?
Yes, doctor. Yes, doctor.
Okay, so also we already put him in what we are calling isolation room or side room because this infection can spread to others. Okay,
Yes.
so it's better to be in a side room and to also take precautions when we are handling him because this infection can spread to the others. So don't be annoyed if you found him in a side room.
Okay, doctor, I cannot visit my father.
Yeah, I appreciate your concern, Mrs. Emily. Actually, I don't encourage you to visit him. As I mentioned to you, this type of bug infection it easily can spread to others. But if you insist, there are some precautions you can take, like to wear gloves, and they will give you also some gown to help not spread the infection. Is that okay?
Okay, doctor. Okay, the doctor, you think my father he will improve?
I appreciate your concern, Mrs. Emily. Actually, I cannot guarantee 100% that his condition will improve. I'm sorry to tell you that in the view of his history of this lung condition and also his forgetfulness, actually his baseline, his body is frail, and this type of infection can in some cases be severe. As I have mentioned to you, it can cause affection of the kidney, it can cause serious problems in the bowels and the gut, and it can cause also what we are calling sepsis, which is toxins to spread in his blood. Okay. I'm sorry for this like bad news, but as I have mentioned to you, we will try our best to help him. We will give him the proper care and we will give him the proper treatment to help him to go through this condition safely.
Doctor, you told me you will stop that antibiotic that's given for my father.
Yeah, we need to change this antibiotic because of the bad effect that happened to him.
Okay, what you will give him instead of the antibiotic?
I appreciate your concern, Mrs. Sarah. Actually, we'll give him another antibiotic to treat his bug infection in the lung and to try to be more safe and not causing these bad effects in the gut.
Okay, doctor. Okay.
Do you have any other worries or concern?
No, doctor.
Ms. Sarah, can I ask you some questions?
Yes,
Two
doctor.
minutes left.
Does Mr. Jones working?
Yes, doctor.
What he's working?
He working in the bank office.
Okay, and okay, so we can also help him regarding this issue. We can do medical report for him, okay, to help him in the work, like to give him sick leave during his stay in the hospital, and until his condition also improve.
Yes, doctor. Help me if you do that.
Okay, anyone living with him at home?
Yes, my mom and my sister and my brother.
Okay, they are doing well.
Yes, doctor.
Okay. Ms. Sarah, also I will give you some leaflets and brochures about this condition to know more about it. And also, if you have any worries or queries or questions, don't hesitate to contact us anytime. Do you have any
Okay.
concerns or worries?
No, thank you, doctor.
Okay, can I ask you what did you get from our discussion today?
You told me, doctor, my father, he has this gut problem because some medication given for him, and you will stop this medication and he will improve. You told me that. We hope so. Yes, doctor.
Yeah, as I mentioned to you, we'll stop the medication, but we'll give him another medication for the bug infection in the lung, and also we'll start for him medication for this bug infection in the gut. Okay,
Yes.
and as I mentioned to you, also the condition may be serious, but we will try to give him the proper care and support.
Okay, doctor.
Okay.
Okay,
Okay.
time is up.
Thank
Time is
you.
up. Well done, Dr. Ala. We will comment after Dr. Mohada comments. You can start, Dr. Huda, please.
Yes, Dr. Ala, he did well. He covered all the task of the communication. He explained for the daughter the condition, and he also explained how this infection happening for him and what the plan of the management. But he must also say he will refer for infection control department, and he gave instruction during visit, and this patient he need isolation because it's a contiguous infection, and we need to take some precaution during visit the patient, including also the washing hand by the swab by soap and water. It's important. He cover everything. Yes. Well done, Dr. Ala.
Okay, I will ask now, Dr. Ala, what do you think about your performance? What you did wrongly? Correct yourself. Dr. Ala.
Yes, yes. Actually, I expected the surrogate will be more tough. Okay, that will be more annoyed from that giving the antibiotic, and he will negotiate more about why you give such antibiotic if it's giving such side effect. And when I'm telling him that we will stop the antibiotics and we will put another safe, that he will negotiate more and tell me that so why you not giving the safe antibiotic from the start?
Mhm.
Uh,
Yes,
yeah, that's why I was somehow maybe hesitated
to
in the
explain.
middle. Yeah, yeah.
Okay, what about bacteria and saying bacteria many times, the antibiotics?
From my side,
Is it jargon? Do you think?
yes, yeah, yeah.
Okay, how
We
to
should say
replace it? Correct yourself.
bugs,
What you should say? And
bugs,
antibug.
antibug. Yeah,
Bugs and antibug. Yeah, simply.
yeah, yeah,
Okay.
yes.
And you can name it as also super bug because it might be very serious. It might lead to severe diarrhea and dehydration, sometimes with blood, and it might end with serious complication, which the toxic megacolon. If you will go through the other manifestation and other complication, but temporary, you can talk about it as disbalance or imbalance between the helpful or the beneficial bug in the gut and the harmful bugs or the harmful bugs. Okay,
Okay,
in which the unhealthy or the harmful bugs being more overgrowth, and it secrete some toxins which lead to the symptoms that your father had in the form of severe diarrhea. In some conditions, this diarrhea, if not treated well, it might lead to serious complication like dehydration, like being also in sepsis, hypotension, and it might lead to also to resistance to the antibug. And I'm sorry, it might increase or worse his coma and the dementia that he has, right?
Yes.
This is the explanation, okay, in the simple, easy way. You did it somehow, but you use some jargon. That's why I've tried to comment and to correct them.
Mm.
Let's go to the comment, the other concern. I wrote it. The nurse without gloves, they brought or
Mm.
she brought the infection to my dad. And you did you apologize for that? Do you think is
No.
it an error?
Yeah, it's error if it
Yeah.
happened.
So
Yeah.
yeah, I apologize on the behalf of the team. I will uh, discuss with the supervisor as you did. But you have to be sorry because she saw something which is not good.
Yeah.
It's
Yeah.
not accepted to have a nurse without gloves. The handling any patient. If you are there, you will not accept, right?
Yes,
So
but I took it like I said sorry. I said sorry for her, and I said only that I will discuss this issue with the charge nurse and to see exactly what
yeah,
happened.
yeah,
Okay, but I don't
we
know
can
if
raise
we would
a report
do
and
the like
yeah.
instant report also and like this or
Yes, yeah, we will follow the steps. We will discuss it, and we will see why this happened, and we'll take it seriously because it's not accepted at all to have a nurse without gloves. It's something serious, and she can transmit the infection. However, it's not the cause of his infection right now. But you have to correct this behavior. It's not accepted behavior. You can say like this. It's not accepted behavior. We have to deal with it seriously, and we will raise a report, and the supervisor will have investigation to see what exactly happened. And we have apologized on behalf of the team regarding this. This is the first concern. The second concern is it serious? I explained already during talking and explanation that it could be serious. It might lead to serious infection and the severe dehydration, hypotension. Sometimes it might threat the patient life. Okay. Can't I visit my father? As you said, it's not advisable to visit him in this setting. However, if only the next of kin can go to the aside room using some precaution. However, it's preferred not to go inside. You can see him from outside, watching through the glasses, okay, or through the window. Will he improve? We will try our best to we will stop the medication. We start the best interest of his condition, the antibiotics for this bug. We change the antibug to another suitable one for his condition in the best interest of his condition. Hopefully, some patient they can recover, and if he will have any update, we will let you know. Will you stop antibiotics? We already mentioned that. Yes, we have to stop the antibiotics which lead to this condition, and instead of that, we will give another antibiotics to kill this bug, and at the same time to kill or to treat the previous infection or the chest infection that he brought with or he presented with. Okay, all the concerns I wrote and I give the appropriate one. You did some of them in perfect way, apart from the jargons only. Okay.
yeah, because I thought the antibiotic is not jargon and the bacteria is not jargon.
Yeah, yeah, we are learning. Maybe in UK, by the way, in UK they are dealing with these words as non-jargon. It's okay for them to say antibiotics, to say fever, to say uh, fever. I mentioned yeah, vomiting, and so on.
Mm.
But in overseas, they consider all this as a jargon. Try to avoid them. Be as simple as you can.
Okay.
Okay. You have other question or you have any comment?
No, thank you, Travis.
Okay. The social, of course, you have to do the support you have to offer, but I don't prefer to repeat or to recap or some scenarios which including some mistakes or something might make the surrogate more angry. You said I am wondering that she wasn't angry. When you ask her to recap or to give you the summary, She might be angry, doctor. Oh my God, you remind me about the mistake the nurse had
Yeah,
done
I
for.
know, but I did it because she wasn't angry.
Okay, offer the leaflet,
I had
brochures,
five
website.
things.
Yeah, try to train yourself how to find the sentence whenever you finish the task. In this scenario, for example, as you did, you offer the help. Who's living with him and who's dependent on him? This is the first solution. The second one, what his job? You can ask about the job and to offer some support if he needs. And the other things you can add, anyone want to visit him, for example. Okay. Uh, initially, you can offer someone to attend this meeting, right? Is it wise to accept or to invite someone to come to this meeting? What do you think?
No, here the patient confidentiality, I think.
But he's confused and he's
Yeah,
dementic, right?
yeah, I know, but I think the
Okay,
other
it's
one should
better
be
to avoid.
clear.
It's better to avoid, but if you do so, it's accepted.
Mm.
But if the patient is already conscious, don't invite at all. If you have confused patient, meningitis patient, and you are going to break bad news, for the support, as usual, we have, or you can invite. I will not say you have. You can invite. Okay. Is it clear now for you and all? Dr. Huda, you want to add any comment?
Yeah, Dr. Basim, it's okay.
Yes,
Yeah.
thank you, doctor.
Okay. Anyone with question regarding this scenario? Let's go to the yes, the infection control. Did you mention the infection control? It's one of the hidden agenda in this scenario. Infection control
Yeah,
team.
didn't mention. I
Yes.
mentioned only the isolation and
No, the aside room, and
mm,
we call the infection or we notify this infection to the office called infection control. They are concerned about such kind of infection in the hospital. Why? To prevent the breakdown of this or breakout of this infection through the hospital. It might spread and it would be more serious. So, and in order not to spread, we put him in a side room, we notify this office. Okay.
okay.
Okay, let's start the second scenario. Your scenario, Dr. Huda. You are the doctor in the ward, patient name Andrew Hanson, 30 years old, counseling regarding HIV testing. Scenario, this young man has fever, sore throat, and rashes. He was losing weight and not getting any benefit from the antibiotics. He is now being investigated for the infection, such as mononucleosis, cytomegalovirus, Epstein-Barr virus. Results are pending. But the HIV test came back positive. The report, the repeat test showed HIV was negative. It was later discovered that his blood sample was mislabeled with another patient who has HIV. The consultant has already filled an insert report. The task, negotiate with the patient and make a joint decision regarding a third HIV test. So, Dr. Huda, you have a first positive test and the second one mislabeled with another patient and it came as negative. So now you are going to repeat
No,
the third one.
no, Dr. Basim.
Okay.
The first test, because yeah, I also got
Yes.
confusion. The first test is a mislabeled test.
Okay.
Yeah, yeah.
The first one was negative, and the second was positive.
The first was positive. This is the mislabeled test.
Okay.
And the second negative. This is a true test for him. This is a second negative.
The positive
Okay,
and the cytomegalo, Epstein-Barr are pending,
yes,
right? But he
Yeah.
has a lot of infection, like sore throat, multiple or recurrent infection. Clear?
Yeah. So
Okay.
the first test is positive, and this is a test which is mislabeled with another patient with positive HIV.
yes. First one, the
Yeah, and the
okay.
repeat test is negative, and they need to do a third test.
Third, yes, okay,
Mm.
Okay.
okay.
When are ready, Dr. Huda? Let's start.
Yes,
Anyone with
doctor.
Okay, take your time. Anyone with question regarding the first scenario, clostridium difficile? It's not a mistake to start the antibiotics and the clostridium difficile infection happened. It's a side effect or complication. No one apologize for this. The antibiotics started in the best interest for the patient or for the patient condition. However, one of the complication might happen. It's called Clostridium difficile, and don't bother about the name. I will explain to you. It's, as I said, one of the bugs which live already in the gut. However, it's being balanced with another healthy antibiotics. Healthy bugs. Whenever these healthy bugs being weakened by the antibiotics, so the predominant will be, or the strong, or the strength of the bug will be to the unhealthy one, or the harmful one, or the dangerous one, whatever. Everyone can use his expression, but use whatever you want. Try to avoid the jargon. However, these bugs, whenever it grows more, the manifestation will start to appear in the form of severe diarrhea, complicated by dehydration, hypotension, sometimes even coma, worsening the all vitals of the patient, and sometimes it's threat the life. Okay. For that reason, we isolate the patient or put him in a side room, and we change the antibiotics and so on. Any mistake during this scenario, you have to apologize, like using dirty or seeing. By the way, there is also another concern that I saw the bed sheet very dirty. It contains some stools. Sorry for this, but I'm sorry. We are sorry. We will search and we will investigate. We will take it seriously. It shouldn't happen because it's not accepted to a family to see a sheet or dirty sheet soaked with stool or with loose motion or whatever. Okay, you have to apologize for such things. Yes, it's something might happen, but it shouldn't happen. Okay, do as you are in your practice. The family coming to visit, and during visiting time, they saw something which they don't like. Simply, they will call the doctor. Please, doctor, we saw 1, 2, 3. The first thing you will do, you will say sorry for that. We will investigate. We will call the supervisor. You will try to calm the family down, and they are being too much angry for these behaviors. They don't accept any nurse to deal without gloves, to see a dirty sheet, to deal or to insert cannula with the hands without gloves, right? All the things considered as mistakes and error should be corrected and should take it seriously. Is it clear for all? Dr. Huda, I'm trying to fill the time, but if you are ready, let's start.
Yes, doctor.
Oh, okay. Yes, here you go.
Hello, I'm Dr. Naji, one of the doctor here today. Are you Mr. Andrew Hanson, 30
Yes,
years old?
yes, doctor, I am.
Mr. Andrew, we are here today to discuss some issue about your health condition. It's okay with you?
Yes, doctor, it's okay.
Okay, Mr. Andrew, you can tell me what you know about your health condition?
Actually, doctor, what I know that I had this high temperature, I had problems in skin rash and my sore throat. And all over the last month, they tried for me multiple antibiotics with no response. And then I came here, they did for me this HIV test, and unfortunately, it came positive. And since that time, my life is hell, doctor, really. Then they told
I'm
me they will
sorry.
repeat the test. So that's what I
Okay,
know.
okay, I'm sorry, Mr. Andrew, for your suffering. What's your expectation, Mr. Andrew?
Actually, doctor, I don't have any expectation. I am already depressed since this result.
Okay. If you give me chance, Mr. Andrew, I will explain for you. Okay.
Okay, doctor.
Mr. Andrew, uh, as it came to my knowledge, you suffering from high temperature and with a skin rash and fatigue, and you use many treatment, but you not feel improve. Okay. For
Yeah.
that, Mr. Andrew, when you are seen by the medical team, they thinking about viral infection. Okay. One of them, Mr. Andrew, HIV, because it came with the same symptom, rash, high temperature, not respond for the treatment. For
Yes,
that, Mr.
doctor.
Andrew,
He did for me the test, doctor, and he told me that already I have the HIV, and then they repeated the test.
yes, doctor, yes, Mr. Andrew. Mr. Andrew, I want to inform you the most of this result is still pending. The result not released, but the result of the HIV already released, Mr. Andrew. And I'm sorry to tell you, it show there is infected by you have. It show there is HIV, Mr. Andrew.
Yes, doctor.
Okay, but I'm sorry to tell you there is a mistake happening, Mr. Andrew.
What
We
mistake?
discovered, yes, Mr. Andrew, we discovered this sample mislabeled with with the sample of another patient. He already have HIV, Mr. Andrew. I'm really
Yes.
sorry.
What do you
I'm
mean,
really
doctor?
sorry.
So the result was wrong, doctor?
Uh, I'm sorry, Mr. Andrew. Yes,
Oh
because we're
my
not sure
God.
this is the
So
because this
it was wrong result, doctor?
yes, Mr. Andrew, as I told you,
A
the
relief. It's
result.
very good, doctor. Very good. Thank you, doctor. Thank you. So I don't have this HIV, doctor?
No, Mr. Andrew, I told you the result of this blood sample mislabeled with another patient. Okay,
Yes.
for that we are not sure. Okay, you have this disease or no, Mr. Andrew. For that we discover this mistake early, and we already take action because this is not accept, Mr. Andrew. Our consultant already he raised the incident report because we not want to repeat this mistake again for you or for another. And I want to tell you also, we take another sample, we send it for you. The result came negative, there is no infection, but
Oh,
we
that's good,
want
doctor.
to,
That I don't have the infection already. It came negative, you mean, you told.
I'm sorry to tell you, Mr. Andrew, we need to repeat the sample again to be sure you not have this infection, Mr. Andrew.
What? Why, doctor? You told me already the result came negative.
Yes, the second result, yes, it came negative, but we want to confirm this result, Mr. Andrew. Okay, I'm sorry. I apologize behalf all the medical team because this is really not accept to happening for you or for another. And I want to tell you, we take this seriously. We will discuss this issue in our doctor meetings because we not want to this repeated. We want to discover where is the defect in our system and why this happening, Mr. Andrew. Are you follow
Yes,
me,
yes,
Mr.
doctor.
Andrew?
But why I want to repeat the test, doctor? It's already negative, and you told me already the first sample was mistake. So already I have two samples which are negative, doctor. Why I need to repeat again, doctor?
I appreciate your concern, Mr. Andrew, but we need to confirm the result, okay? Because sometimes the first result can come negative, Mr. Andrew, and we need to repeat it, the result. We need to
Yes,
repeat
doctor.
it this
I did it
two.
already two times now. The first one you told me it was wrong, so I don't have the disease, and the second one also it's negative. So this 2 times now already.
Yes, I appreciate your concern, Mr. Andrew. Yes, as I told you, there is mistake happening in the first sample. Okay. But as I told you, Mr. Andrew, the second result, yes, it came negative. But sometime in the early of the disease, we may have the result came negative. For that, we need another sample to confirm the diagnosis, Mr. Andrew.
But why, doctor? Why
You
you are
understand
insisting on
me?
doing the HIV test for me, doctor? You did already another test for viral infection. They told me, why not just waiting for the other test? Why doing the HIV test for me?
Yes, I appreciate your concern, Mr. Andrew, because the symptom of the HIV, it's same the symptom you have, Mr. Andrew. Okay. And if you have this HIV, you can have another also viral infection. For that, we send it for all. Now we need to confirm the diagnosis, Mr. Andrew, and we want to be assured you not have this infection. For that, we need another, the third sample from you, Mr. Andrew.
No, doctor, I don't want to go through this again, doctor. Really, it made my life hell, doctor, this result. My girlfriend already left me, doctor, because of this. I informed her that I have HIV and she left me, doctor.
I'm sorry for your suffering, Mr. Andrew, and I apologize for this mistake, Mr. Andrew. But if we, I know, I can know why you not want to repeat the test, Mr. Andrew.
Yes, doctor, I mentioned to you already. It made my life hell and my girlfriend already left me because of this. Actually, I need to go to her now. I inform her that the result is negative. Can I do this, doctor?
2 minutes left.
Okay, Mr. Andrew, I want to tell you, if we repeated the result again and it came negative, that's time sure, we are sure you not have the disease, Mr. Andrew. You not have this HIV infection. Okay, Mr. Andrew, and that's time you can assure your girl friend about the result, Mr. Andrew. It's okay with you?
No, doctor, it's not okay, doctor. I don't want to go through this again.
Mr. Andrew, as I told you, if you did this result and it came again, it not show any no, it show negative for the HIV, that we are sure, and you are also sure you not have the infection, Mr. Andrew. For that, you can feel comfort and you rest. You can feel comfort because you are now. I'm sorry. I know how much this hard news for you, Mr. Andrew, and how much you suffering because
One
of this
minute
result.
left.
But if you repeat, but if we repeated the test and it came negative, Mr. Andrew, that's time you can feel comfortable, Mr. Andrew, and you can assure yourself and another, your family, you not have this infection, Mr. Andrew. Are you
Oh,
follow me?
you mean, doctor, you will force me to do the test?
I'm not force you, Mr. Andrew. I'm sorry if you feeling like that. But I want you to understand this is we need to assure you, okay, Mr. Andrew. And if you do the test, you feel also comfortable because you will not have this infection if the result came negative. Are you follow me, Mr. Andrew?
Yes, yes, doctor.
I I can I can give you some paper, leaflet, and website to read more about the result of the test, and you can understand why we need to repeat the test again, Mr. Andrew. Okay. You can tell me what you do for living, Mr. Andrew?
Actually, doctor, I'm accountant.
Okay, how much this affect you, Mr. Andrew?
Yeah, doctor, it's affecting me too much. I told you my life was miserable the previous days because of also my symptoms and also this result of HIV.
I'm sorry for your suffering, Mr. Andrew. I will try to help you, and I can inform the social worker and occupational department if they can help you. Okay, Mr. Andrew, you live with who, Mr. Andrew?
I'm living alone now, doctor. I told you my girlfriend left me.
Okay, you need any help, Mr. Andrew?
Thank you, doctor.
Okay,
Okay, I'm sorry. I'm sorry again for this mistake, Mr. Andrew. I appreciate your feeling, Mr. Andrew. Thank you.
okay. Yes,
Thank you.
time is up. I added 1 minute for the social and the occupational. But let me tell you, Dr. Huda, if you spend 20 minutes or 30 minutes negotiating with him without asking or without convincing him, he will not accept. What do you think the missing point you didn't do? Before Dr. Ala, sorry, before Dr. Ala comment, sorry, Dr. Ala, but I
No,
want
no, no
him
problem,
to know
Dr.
Um,
Bassel.
why the surrogate still negotiating with her and he's not accepting. What do you think, Dr. Huda?
yes, because the second result it came
No,
negative.
no, no. It's not related to the
What,
result at all, by the way.
what, doctor?
What do you think? Why you want to do the test? Why what he has to do the test? Why you are
Yes,
suspecting HIV?
because the symptom it seemed like HIV,
So
doctor.
why you
You
didn't
mean
tell him?
yeah, I tell him, doctor, the symptom it's look like HIV. We send another infection and we send the test.
You told initially, right? You,
Yes.
at the beginning, I mean, but you didn't tell it again that you mostly or you might have this condition because of the symptom that you have. I think so. Let's hear Dr. Ala comment. Then I will
Okay.
comment.
Okay.
But I want to ask also Dr. Hoda one question. What do you think about the scenario of HIV? What you need to do in scenario of HIV? Counseling about HIV.
Uh, I think social important. I must ask about the. I don't know if I must ask about the route of infection, if he used a
Yes,
drug or
there is
something.
the risk.
Yeah,
Yeah, you should ask him about the risk. That's why he
yes.
was asking you why you want to do the test for me. Okay, you should
Okay,
ask
but
him about the risk. You should assess the risk of HIV. You will tell him that this HIV infection we are suspecting when there's some sort of infection that resistant to the treatment that we are giving, and also if there is some risky behavior that predispose the patient or the person to the HIV, like sharing needles, like doing tattoos, like doing unsafe intimate relationships. Do you have any of these risks? He will tell you, I will tell you that one time, doctor, I did unsafe sex, but it was long time ago. So you should assess the risk of HIV. Okay.
Okay.
So what's more?
Uh, um, not sharing his object with another and
The safety
not
nettings.
not
Yes.
yes not
Yes.
a blood donation.
Yes.
But
Good.
I
You
concern
concentrated in the
yes
medical
on the
error.
mistake. I want
Yeah, yeah,
yes.
you concentrate in the medical error. But the scenario, if you find it like it contains two categories like this medical error, you try to finish it rapidly. The medical error, even the patient wasn't concentrated in the medical error.
Okay, okay, doctor.
He did not ask it for complaint.
Because
He wasn't yeah, he wasn't concentrated about the medical error. You try to finish it rapidly, the medical error, then concentrate in the counseling about the HIV and try to fulfill all the components about the counseling of the HIV. What else you should also tell him about HIV?
uh,
What's the importance of doing the HIV test for him? You told him that one thing that we will be sure and we will get relief when the result was negative. But what if the result was
yes,
positive? You should also tell him if the result came positive, we will be able to start for you treatment early to prevent any bad outcome to happen from the infection.
okay,
Okay. The other also important thing about the HIV is the confidentiality.
yes,
Okay. You need to,
yes,
yeah,
okay,
you need to assure him that the result will be handled only to you. No one will know about the result. So you will assure for him the confidentiality. So
Okay.
the problem for you in this scenario that you concentrated on the medical error and you neglected the whole issue of the HIV testing, and you even in the middle you were apologizing about the mistake, and he didn't acquire about the mistake or he didn't ask about the mistake. So I think it's like some sort of misconnection, or yeah, you are not like connected with the patient. You don't know what
Okay.
he's thinking about, what he's concentrating about. He asked you why you want to do for me the HIV test. Why you are not just waiting for the results of the other tests that you did already. You should like
Okay.
you should let the patient lead you through the conversation, and you prepare yourself from the start that I want to discuss about the medical error, so I will admit the error, apologize, and I will talk about the action. I have counseling about this disease. Should I will talk about this point, this point, this point, to try to
Yes.
fulfill the at least the important points. Okay.
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 Because I think because the result came negative, I'm not hurried to tell him about the HIV. Maybe the result came negative.
Yeah, but
For that, I think
we are
this is
still
I can
suspecting
okay.
that he has HIV. That's why we need to do. You are so you are not convinced about doing the test. You should be. You try to convince him. So you have your
Okay.
yeah
Yes, I
idea how
understand.
to convince him about doing the test.
Okay. Okay. Yes. Yes, doctor. Thank you, Doctor Hala.
Thank you, Tuhad.
Okay, thank you, Dr. Ala. It's very ugly scenario. Sorry for this word, but believe me, the worst scenario ever in communication is to negotiate. You know why? Because you don't know why and what the surrogate needs. He's trying to lead you, but you are trying to mislead him. He will try to guide you to another thing, and you are convincing him for the something different than he's thinking, and the time will be already passed without reaching to what you want and what he want. The task of negotiate is very bad task in the communication. How to overcome it? As Dr. Ala said, you have to know what inside his mind and why you want to do the test. In this scenario, he has already the symptoms and he's highly suspected to be HIV. Add to this, he has the risk of being contracted the HIV, either because of bad risk habit, but don't ask him as a question. Talk to him as an instruction. This infection might be contracted by different risky habits in the form of having unprotected sex or sharing needles or tattooing in and bad hygiene center or receiving blood previously but not now because all blood now is supposed to be clean. These are the risk habits in which anyone can has or can have the HIV infection through them. He will tell you, yes, doctor, definitely. Don't ask him. He will tell you by himself, yes, doctor, you're right. I had, for example, tattooing, piercing, or sharing needles before. So it will be more appropriate that he has the infection through it. And it will make sense for him. Oh my God, doctor, do you think that I catch this infection through this? He will tell him, yes, that's why we are caring for you and we want to do the test for you to be sure. Since you are having the symptoms plus this risky habit, our goal now to confirm that you don't have the HIV. We want
Yeah.
that. Yeah, we want to confirm that you don't have. But in case you have it, it's better to start the medication as soon as possible. Be sure that whenever we start the medication, you will be responding well and you might live near normal life. It's a good response to this medication and we have good experience with this medication. Okay, he will tell you, okay, doctor, but if you insist and he will, no, defense, no, doctor, I don't want. No, please, we have to do. No, I will not do. Why you want to repeat? you will negotiate and he will negotiate with you without reaching to the end point, which is repeating the test. Why you want to repeat? Tell him. Okay. You can do
Yes,
it in
okay.
another way. Why you don't want to repeat the test? Tell me. Whatever the reason, you have to convince. I'm afraid my girlfriend will leave me. Now, this is another very important concern. I appreciate you worry about this, and don't worry about that. We have our expert team that they can inform your partner or your girlfriend without any harm in the form of pieces or in co-joint with the meeting with your partner or your girlfriend, and by somehow we can deliver this news to her without harming this relationship. Okay, he will
Okay.
also accept it. So this one was one of the concern. The other concern already, why you want to repeat? I wrote it many times because you didn't address it. Why you want to repeat since it was negative? Why you want to do since it was negative? I don't want to do because it was negative. The same answer, because you are having the symptoms. Plus, you might have catch the infection or caught the infection previously due to
Sorry,
this
Dr.
kind. Yes,
Bassam.
yes,
Yeah, sorry for this concern. Yeah, I repeated it 2 times because,
yes.
yeah, to direct her to something. This mislabeled sample, it's not considered as a test because he told you already, I have one test negative and the other test is negative. Why repeating again? You already repeated it. You should inform him this sample, which we did in the first time, which is mislabeled. We cannot rely on it. Okay, there was a mistake in this sample, so it's not considered, or we cannot rely on this result. So this is only the result. First one, the second one is negative, so we need to
Yes.
confirm it with the test.
Yes, okay.
Absolutely right. Yes, absolutely right. So we want to confirm that you don't have. Sometimes initially the test will be negative, the antibodies will not appear, but later on it might appear in the blood. This is
Yes,
scientifically. But again, you have to know what he's thinking about and convince him through it. Don't repeat the point. Don't convince for something he's not accepting. He will negotiate more and he will resist more. Okay. If he's still
yes,
resisting, please leave this point totally. Go to another thing which is most important, like the social and the safety netting. Here is very important. You didn't reach to them until the minute 11 or 10. Why? Because you spend a lot of time trying to convince. If he's not convinced, leave it totally. Find another task related to the scenario. In this scenario, the HIV counseling, even the point of girlfriend should be counseled because it's very important. Now you want to, even if you have time, you want to screen his girlfriend, right? In case, don't tell it. In case one of the result came as positive, this is the time to counsel him about his girlfriend screening. But again, it's not the time. If he has positive, you have to screen, okay? Or
yes,
to
yes,
screen those people who had contacted with them as unprotected sex. Back to the
okay,
confidentiality, I agree 100%. I always saying, whenever you have scenario about counseling, genetic counseling, whenever you have a scenario regarding HIV or hepatitis B or sexually transmitted disease, and you want to talk about these things, confirm and reassure the confidentiality to the patient from the start.
yes,
We are here in this meeting. It's confidential. Be sure that no one will know about this. It will be between you and them, unless this thing or this information might harm others. Okay, so you assure the confidentiality as long as it will not harm others. Why? Because in some point, if he has a contact with some person or his wife even, and he doesn't want you to inform the wife, you might breach the confidentiality, right? You will ask him earlier, please inform. If he resists, you will tell him, please try to inform. No, I'm afraid. Try to find a solution. And if he's still resisting, and the wife and the kids might be harmed with this hiding news, you might breach the confidentiality in order to screen the wife, even by saying anonymous clinic, but you might have to breach the confidentiality in order to save the family, right? Because if he hide this infection from his family and you kept his confidentiality, maintain the confidentiality, and the wife, for example, was having the HIV, he will continue hiding the information, and the wife will continue having the HIV, and the wife will end up with AIDS, right? You will not accept that. Doesn't make sense.
Yes.
So in this condition, you might breach the confidentiality. I'm so sorry, but without confronting. Okay, don't do anything like by force. And one also of the concern, will you do it by force? You have to say sorry if you understand me in this way. No, we never force any patient to do something, but we always care about your condition, your health, and we want you the best in the rest of your condition. Okay.
Okay.
Yeah, the safety netting is very important. Please, till confirming the result, please don't share the needles. Don't share even not not needles. Don't share your private tools. Don't donate blood. Do not have
Yes.
unprotected sex or use a protected sex. And whenever the result will be negative, this is the time you can do whatever you want. But till that time, please be careful and use these precautions. Is it clear?
Okay. Yes.
A lot of talk in the HIV topic, but you have to say them in the proper time. If you will say all these things, of course, you will not have time for the task. But again, it will depend on the surrogate concerns. So try to listen and address. Don't start to enumerate, to counsel without knowing what he wants. Otherwise, you waste the time and you will not reach to the task, and you will not and address the concerns. So you will fail the station. Okay?
Okay. Okay.
Okay. Any question, Dr. Mahmoud, or sorry, Dr. Ala or Dr. Huda?
No, really, thank you very much.
Thank
More
you.
informative.
Sorry?
More informative, because I really I
Yeah,
cannot
it's
deal with
common. It's
HIV.
common scenario HIV and TB sometimes also comes. Be ready for this. By the way, HIV is not notifiable. Sorry, no, HIV is notifiable. The TB, the HIV is not notifiable, and the TB is notifiable. Okay,
Yes.
HIV is not notifiable anymore. The tuberculosis is notifiable one.
Yes. Okay. Thank you very
Okay.
much.
Yeah, thank you. Doctor, okay, let's go. Dr. Ala, you want to comment or to add any question?
Hi.
No,
Hi,
thank you.
Dr. Bassem.
Yeah. Okay, Dr. Mayada, you want to comment?
Yeah, I'm just want to comment in one thing. I think this scenario of 2 points. The first point is the mistake, to admit the mistake first. It's important, even the patient, because the main task now, the first task to be addressed as our role of candor, that there is a mistake and we deal with it, that we did you can say that we have incidents report and everything, as because this is horrible mistake really. So then after that, after you deal with it, as then you see how your patient is react. In this scenario, the patient was very happy that it's okay, he's not mine, so you will not take a lot of time on the admitting the mistake, but still you need to say that there is incidents report and this is mistake must not happen, and apologize to the patient. And after that, go to the main task that the patient he's not need. He didn't want to do the test, and whatever happened after that. You got my point. So mistake must be admitted in this scenario.
Yes, yes, definitely. We have to do. Yes, you're right. Yes, Dr. Maida. Another point.
Yeah, this is the main thing.
Okay.
And I think Dr. Huda
Yeah.
take a lot of time because she didn't at the start, the beginning. I think in this scenario, if she just start with the beginning, what the patient knows, because he's already have the results of the previous results, he's already have it, and he knows that he has HIV. So if she just start from that point and go on, this will save a lot of time. She have a lot. She spend a lot of time to try to say this is happened, no, but this is happened, and if she just start from the point where is the patient, what the patient knows about his condition, she can save a lot of time.
Yes, absolutely right. That's why the introduction is very important. Now, you please follow the steps of any introduction. Introducing
Yeah,
yourself, confirming the data,
a good
asking.
additive also. It's a good additive also, Dr. Maida. The thing, yes, you mentioned is right, because the patient already told you the information. Do not repeat it again. Do not repeat the information again. Try to start from the last thing that the patient mentioned. And if you want like to reach a point, like make it more concise. Don't make it detailed again, because you will lose time. The patient already knows about all these events. You told you have this sore throat, you have. He knows about it already. So try to not repeat it again to the patient.
Okay.
Yes, right. Whenever you are going to start a scenario, follow the steps and don't repeat as usual advice. If you want to do, just start from the point he stopped in. After that, address the all coming concerns. Don't repeat anything he knows. Otherwise, you will waste the time, you will not reach the task, and you might lose the concerns. Okay,
Okay,
clear?
Dr. Basim.
Yes.
Yeah. Okay. I'm sorry, I have a question.
Yes,
Yeah,
Dr.
regarding
Sam.
this scenario, yes, just because it only 10 minutes, just it include the issue of medical error. I mean the mistake here, and also we need to convince the patient to repeat this test to be confirmed. So also we need to advise regarding safety netting advice and other, and the HIV itself not confirmed yet in such cases.
Yes, exactly. So you'll start by the apology for the mistake and start from the point that we want to do the test. It's so far negative, but we are still suspecting HIV, so we have to do the test again. No, it was done. It was mistakenly mislabeled. Yes, that's why we will consider it as not done. And we want to confirm it again. Okay, I have result negative. Okay, our policy that we have to do every now and then the test to confirm that we don't have or you don't have the virus inside your body. Sometimes initially the result will be negative, but later on we have to repeat because it might turn to the positive. In order to catch the positive result as soon as possible and to start the medication immediately, and you have good recovery rate whenever you have the result as soon as possible. This is the truth. Anyone get needle stick injury, we are doing zero testing, right? And we are starting the prophylactic even we don't have good or positive results. But we will start it in order to cover this prophylaxis time. And after 1 month, we'll repeat again. After 3 months, we will repeat again, right? Because the antibodies take some times, right? So even starting the medication, you are repeating the test. That's why you have to repeat the test. It's not a matter of one result as negative. I'm talking about the scientific part. Add to this the mistaken result, which is mislabeled. We will not consider it at all. Clear? Is it
Okay.
clear
Yes,
now?
yes, yes.
Okay, Dr. Ala, you want to say something?
Oh, thank you, Dr. Basim. Thank you.
Okay, Dr. Huda.
No, thank you very much.
Okay, Dr. Gabriel, as usual, good comment. Yeah, this is a challenging case. Yes, of course. So many learning points. Great. Yes. I hope you got the point how to address every point It's a challenging one and difficult to deal with it. Plus, having such task of negotiating or difficult and tough surrogate or even angry surrogate because there is a mistake. So what you will do to convince or to go negotiate or to counsel or to apologize? You have a lot of tasks. So you have to be smart, utilize your time well, and hopefully you finish the task with good marks. It's a difficult scenario, I agree, but you have to be as calm as you can. Okay, everyone?
Excuse me, doctor.
Yes, sure.
Sorry. If the patient here have a problem with the first result, if he say to me, no, doctor, I want to repeat it because the first result it was a mistake. How I guarantee or how I can make sure this is not mistake
Perfect.
happen?
Perfect. It's one of the concern, by the way. You're
Yeah,
right.
here my task try to I will concentrate on the medical error and forget anything about HIV. But here the patient almost say no. I just will not want to repeat. He forget about medical error.
Yeah.
But if the patient say to me, what I can, if that mistake happen again, what I shall do at this point?
Yeah, I lost the trust, you mean. He lost the trust, right?
Yeah, he lost
Yeah.
totally.
So, in order not to, first of all, apology, of course, you have to do the apology and to confirm and to reassure him that we will be very careful next time. We will not mislabel your result again. Don't promise. It's a rule in basis. Don't promise. Don't tell him, I promise you, because it might happen again and
Yeah,
again. So, what you
yeah,
have to do, reassure him that we will be careful and we'll take our precaution not to be mislabeled again because we already have mistaken this result with you previously. So,
yeah.
that's why we are trying to reassure him. Okay?
Yes, and if he forget anything and he just said to me, no, doctor, I just wanna raise a complaint about this result.
Yes, this
It
is
is
his right.
totally direction the dialogue.
Exactly. Yeah, guide him to the Pulse office. This is his right because you
Yes.
already give him negative result for another person and he has the right to complain,
Yeah.
right? Yeah, good
Yeah.
point. Thank you for raising this concern because it was one of the concern in this scenario.
Yeah. First of all, thank you, doctor.
Yeah, thank you, Dr. Basam. By the way, let's use one concern as a weapon, okay? What if you told him about his partner and girlfriend?
Yeah, yeah.
We want to do the test in order to have a safe life with your family, with your girlfriend, the loved person you want to live with them, your kids in the future.
Yeah,
He
this
will
is my
tell,
weapon. I will use it. Yes.
yes, he will say, yes, please, doctor, do it. I want to have a safe life. I want to start the medication as soon as possible because you are assuring him that the medication can kill or not kill totally, but at least it can let him live near normal life with very low viral load in his blood or in his body. In the other side or in the opposite side, if he will not do the test and he will
Yeah.
continue having the infection
Yes.
without medication, he will be deteriorating with the time. The defense system will be weaker and weaker. He will catch even simple bug and he will be diseased from everywhere and he will be manifested with multiple infection and he will catch what he will have what is called AIDS, right? AIDS, and the AIDS is the maybe the end stage of the HIV. And in this situation, his immune system or his defense system will be catching simple and maybe a very weak bug can kill him. And this is the truth.
Yes.
So you can use a lot of weapons. It's a big topic, as I said, but how to use and how utilize every weapon, this is the challenge. Okay.
Yeah. Thank you, Doctor Basu.
Yeah. Thank you, Dr. Musab, as well. Anyone with question?
Dr. Bassem,
Yes. Yes.
excuse me. in the practice that when the HIV test it's come positive, so you must start treatment direct, right?
Yes.
So here, يعني, there is some point not because he said the first test positive, then he make second test is negative, then they said there is mistake or mislabel or something like that, right?
Yes, because the first test was positive for another
Second
person.
one, yeah. So if the negative, we need to make يعني, not in this
Yes.
scenario as regular. If the test positive,
Yes.
we will start treatment direct, right? And
Exactly.
if
Yes.
negative, we need to make it 3 times if there
Exactly.
is high suspicion to have HIV, right?
You will repeat it after 1 month.
Only 1 month, okay. Sorry.
Yeah. And 1 and 3 months.
1 and 3,
This,
okay.
yeah, this is not as prophylaxis. It's different. If you have a patient with just now needle stick injury to a HIV patient or had a sex contacted with the HIV patient and he told you, doctor, I had it recently, definitely you have to start what we called
Prophylactic treatment.
PEP.
Hmm?
Yes, yes.
Yes.
Post-exposure prophylaxis. And you repeat the test and you will follow the protocol of the infection control. But now you are dealing with patient already, you are suspecting he's having HIV. So you will do the first, if negative, you will repeat it without starting the medication because you don't have any confirmatory test. Yes, he might tell you about the past exposure, but already passed a lot of time, so you don't have any confirmatory history from him. In this scenario. But if you have another scenario, which is needle stick, you have to start immediately the prophylaxis one. And it's different than the HIV itself medication, anti-heart or the heart medication.
Because في another scenario I heard from
Yes,
it's like a test positive and sit with the patient, and the other test like CD4 and the load of the viral not yet done, but the test first positive. So sit with the patient and talk with him about
start
start
starting the
medication.
medication. Yes, it's positive. You are waiting
Positive.
for the positive to start the
And
medication.
the CD4 and loud viral, it's not important for now for the start medication, but it's important later for something prophylactic for another
Yes, it's
infection,
for the
right?
other, yes, prophylaxis for antibiotics
Yeah,
for,
but another scenario. Okay,
yes,
okay.
pneumocystic cranii or the prophylaxis for toxoplasmosis according
Yes,
to the CD4 count. And if this patient can live with the donation or he has to be still as precaution,
yes.
whatever the viral load,
But this,
right?
yes, not
Yeah, this is
important for
different. No,
start.
no,
Yes, yes,
no,
yes,
this is not for the start. This is for another thing. Okay,
yes.
it's
Thank you.
different. And the task will be for starting the heart medication, how to counsel about the heart, about the possible side effect, about the
Yes.
reactions, and so on.
Mhm.
It's different, totally different scenario.
Yes, yes. Thank you.
Okay,
Yeah.
most welcome, doctor. Any other questions?
Dr. Basim,
Yes, sure.
at the end of this scenario, if the patient still refuses to repeat the test after explaining everything that you have repeated infection and you have a high risk like unsafe sex or blood transfusion, what I will say, I will arrange meeting with our
Yes, exactly.
consultant.
Yes, exactly.
Okay. Okay.
Yeah, this is it will be like refusing treatment or refusing investigation.
Mhm,
But this is
mhm.
against his sake. So you have to arrange a meeting with someone else who has the experience to convince him. That's why if you feel your patient is resistant and the scenario will be waste without reaching to the other points, please tell him, okay, I will arrange a meeting with my consultant. He is in a better position to convince you and try to do the other support and other task in the scenario.
Okay.
Okay, and you will know from the start that it will not be negotiate, it will be refusal of investigation, refusing of receiving medication. And in these scenarios, don't waste the time to convince. They know that, or you know that he will not accept it at any point. So the steps of refusal you will follow, starting to convince. If not, you have to address why. You have to ask again why. If you reach to 3 whys and he's still not convinced, have another meeting with your consultant. Let him sign the paper of refusing or DAMA or whatever the scenario, either discharge or receiving medication. Let him sign at the end. If he's still insisting, even if you are arranging a meeting with your consultant and he's still refusing the task or whatever the task, okay?
Okay, thank you very much. Thank you.
Most welcome. Any other question? So you have 3 different scenarios to counsel about HIV medication, or another scenario like our scenario today, negotiate about repeating the test because of mistake and you have to apologize, or you have like what the doctor mentioned now, you have a scenario with the patient refusing totally, and this again is mistake. So in this time we have to call for help, another meeting, and if he's still insisting, tell him about the seriousness. You have to tell him it's very serious that if he didn't do this thing, and at the end let him sign the DAMA or whatever, refusal of the treatment or refusal of discharge or refusal to stay or whatever the decision of the scenario. Okay, is it clear for all now?
Mr.
Yes.
Basim, is
Yes.
it coming before this scenario, typical scenario like what we discussed?
Refusal,
No, typical scenario here. Is it coming?
negotiation.
Yes.
Yes, doctor,
Actually,
it came before.
yeah, but not. By the way, it wasn't only HIV. It was HCV, hepatitis C.
Okay.
So
Yeah,
you might have.
he's asking about the same scenario, the typical
Same
scenario.
scenario.
Yeah,
Same
the
scenario
typical
here.
scenario came before, yeah, but came in UK.
Oh.
Yeah.
Yeah, because they don't have a lot of scenarios. Sometimes they are creating new scenarios.
You make my heart
Really,
beating. It's a difficult
yeah,
scenario.
it's difficult and challenging
And
one.
it not can cover all things. Many topics.
That- yes, exactly. So you have to be smart while talking and try to know what he wants from you. And
Yes.
the point he will tell you, address it.
Yeah. And the
Don't.
task.
Yes, of course, the task you should do it, but you have to know what's inside his mind, what he want to say, what he want to hide, why he want not to do the test. I should find out what behind his thinking, and I will address him.
Yeah.
Okay.
Okay, thank
Okay. Thank you too. Any other question? It's nice topic today with good interaction, with a lot of concerns, and the scenario is complicated.
you.
Even
Yes,
the discussion,
help a lot of yes.
yes, because it's very difficult scenario, challenging one. Not only as HIV, because of the negotiation. Negotiation means you don't know what's the hidden agenda in the scenario. You don't know what the surrogate wants.
Yeah.
Okay. Some scenarios are clear, like procedure. Explain the procedure and that's it. But negotiate. Why you don't know what he wants from you and what you have to do for him. You will spend all the scenario like fighting in a
Yeah.
closed circle. You are trying and he's saying no. You are trying again and he's saying no. Because no clear task. It's negotiation. Oh my God. What I will use, what I should say, it depends on his mind and instruction, and it depends on your also being smart and using your weapons. If you could convince, the negotiation will be end early. If not, good luck. You will negotiate till the end without support, without social, without job, without anything. Means that you not definitely, mostly you lost the scenario. So BDD for such kind of scenarios, try to train on this scenarios, and hopefully it will not come at all.
Inshallah.
Dr.
Inshallah.
Basim,
Yes. Walaikum salam.
sorry. Really, I have something not understand because in HIV in general we have already to do 2 tests, one for screening and one to confirm. Is that right?
If you have already positive history, right?
Yes.
Based
Even
on the
even
history.
even even the first test is came positive.
so I have to confirm it. So
Yes,
anyway, I have to do it 2 times.
yes.
Is it like that?
Yes, with confirming past history. You should have a patient with risk habits. Not every patient you will tell him you will do for him HIV, right? Let's imagine another thing. Okay, if you are
Yeah.
as a health worker, you are going to join a new company or new institute. They will do for you this test. Do you think they are doing it? Hello?
No, but I
They are
mean
not.
for this patient. Yeah,
Okay.
but I mean for this patient in general, if he has risky behavior or
Yes.
now
Yes, you
classified
have to
now
do.
he
Exactly.
has risk,
Yes. You have to do
I have to
initially.
do. Yes, I
Yes.
have to
If
do
the
two
first came as negative,
tests.
you will repeat it again to confirm that he doesn't have, because sometimes initially you don't have the antibodies. It takes, I think, 1 month to appear. So you will repeat the test again.
Yes,
Not the
yes.
antigen, the
Because even
antibodies.
the test is different. The test we did the first time different from the second time test.
That's why I'm
The
saying the
test is
antibodies. The
yeah,
first one,
yeah,
antigen, P24,
yeah,
right?
yes,
But
yeah,
definitely you will have repeat the antibodies after 1 month because the P24 is not sensitive.
yeah,
Sometimes it will not appear. So you will do the ELISA for antibodies, right? If confirmed,
yes,
the next
yeah,
time you will do the PCR and viral load and so on to confirm the
yes,
viral itself. Clear
yeah.
now?
Yeah, yes, it is clear now. Thank you.
Okay, most welcome.
Yeah, thank you.
Okay, other question or comment, inquiry? Okay, satisfied all now?
Thank you.
Okay, thank you, Dr. Ala and Dr. Huda. You raised a very
Thank
important
you,
and
doctor.
Thank
yeah,
you.
debatable scenario, which is the HIV with the negotiation. Again, it's difficult, challenging, but hopefully you can do it in a proper way. Thank you, everyone. Thank you for all the questions, for the interaction today. We'll see you, inshallah, next week with the short station, as along with the long and the communication. Have a good and nice weekend. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.